greatest modalities in having intervention that is non-medically based to give very significant effects in terms of the main health condition that we're looking at treating.
I agree.
So with acupuncture, a lot of people wonder, what is the philosophy of acupuncture? How does it work?
Well, in the human body, it's believed that we have energy pathways that through which energy flows, and they can help connect the internal organs, they help connect the sensory organs, they help connect the musculoskeletal organs and the emotions and the mind as well. So as you can see on this model here, there are many energy pathways that go through our body. There is like a total of 15 energy pathways. So the theory is that there should be free flow of energy and blood through the body in order for there to be no disease, in order for there to be optimum health. Mm-hmm. When there is an obstruction in the channel or when there is a deficiency in the channel, you will have symptoms of imbalance and that will cause disease.
Mm-hmm. I like the approach of the traditional Chinese medicine because it's not just simply looking in a book and saying headache, let's treat that.
I agree.
How do you approach assessing an individual differently?
It's quite a complementary modality in China, and now more and more people are accepting it in different countries. So basically when a patient comes in, we do a full body analysis. So if a patient says they have a headache, I always ask them, where exactly is your headache? Is it in the temples? Is it on the top of the head? Is it in the occiput? It really depends where the headache is. And then we try to figure out if there's anything else going on in the body. For example, is there insomnia? Is there depression? Is there any digestive problem? So we correlate the symptoms to figure out what is the best points to treat this patient with.
Mm-hmm. And I know that when we do assessments, as naturopaths, we're trained to also look at the tongue because that's a map to the body, as well as checking pulses, but not just how many beats per minute you have, but the energy pathways actually correlating to different areas of the wrist, which represent the organ systems.
That's correct. We have 3 pulse positions on the right, but then there's 3 depths to it as well, and 3 pulse positions on the left and 3 depths to it too. So like we have the lung, the spleen and the kidney on the right, and then we have the heart and the liver and the kidney on the left. Mm-hmm. So, and the kidney kind of relates to the adrenals as well in Chinese medicine. Yes. So, and the spleen relates to pancreas as well. So we figure out whether there's any pancreatic insufficiency, for example, or any adrenal fatigue. Really good way of figuring it out.
Speaking of adrenal fatigue, let's tie it back to anxiety. So how does acupuncture help anxiety?
Well, acupuncture actually helps to relax the muscles in the body. When the muscles are relaxed, then a patient will breathe deeper. When a patient breathes deeper, they feel like, more relaxed, more calm. And when they are more calm, then, your whole sense or awareness around the a situation that's causing anxiety changes. Mm-hmm. It's all about perspective, isn't it?
That's right.
So if you're feeling calmer, your perspective on the situation is much calmer and you're not as anxious and agitated about it.
Absolutely. Yeah. Because really stress is a perception of a dangerous and threatening situation.
Exactly.
Because you and I could go to the same event and you could have a wonderful time, whereas I may feel anxious, and it's our perception.
Yes.
So the acupuncture, a lot of people are fearful of needles. Mm-hmm. So how do we communicate to them that acupuncture is okay?
Well, usually when a patient comes in and they say that they are actually afraid of needles, but they have tried a lot of different modalities and they really want to get better, they're usually wanting to try something that will really help them. I ask them to take a big deep breath when they're lying down. So the environment is very calming and relaxing. There is dim lighting, there is good music. So that in itself is therapeutic. Mm-hmm. And then when a patient takes a deep breath, that's when I insert the needle in. And if they're still scared, say, because there will always be children who come in who are nervous, and they don't want the needles. In that case, I'll do acupressure.
Sure, that works as well.
Yeah.
So to do a demonstration for our audience, how can you share with the audience what would actually take place in a session?
So in a session, as I said, I will do a full questionnaire, and then we'll be looking at the tongue. and I will also feel the pulse, and then figure out what the chief complaints are, because even if you're anxious, you may have a completely different physical symptoms related to that compared to, say, me. So you may have like insomnia and I may have a digestive trouble. So we need to figure out which points to do for you. So after that analysis has been done, then the patient lies down, and usually they lie down either on their back or face down. It may be a lateral position, or if they're really uncomfortable, we may even have it seated. I prefer them lying down. And then basically all needles are sterile, disposable, individually wrapped. So after the point selection, never used again, they will be disposed of right away. So when I take them out of the wrapper, they are all in a plastic tubing like this, and they have a blue tack on the top. So I take that out, and now I'm holding the spring. The needle itself is really, really fine. I don't know if you can see it on the camera, but it's really, really fine. And so I never actually touch the needle.
Yes.
In an ideal environment, I would put alcohol and sterilize the area as well, but with your permission, I will go ahead. So this is a good point. It's called the large intestine 4, fourth point of the large intestine channel. It's really good point for just calming the nerves, releasing the stress. Really also good point for headaches or any symptoms associated with anxiety. So
I find that it is the key point. When you're learning acupuncture, it's the key point that you learn on. And what you basically feel is you feel a bit of a pinch sensation. I mean, I really didn't even feel that. And then you'll feel a heaviness, warmth, or perhaps even a tingling.
And sometimes you may feel energy going down the channel as well.
That is correct.
Yes.
You also have seeds. How are those different than needles?
So seeds, actually, I may give to patients to take home. Like if they have a lot of anxiety and they're having difficulty sleeping or they feel agitated pretty often. So I will teach them a few points, some like homework for them to stimulate themselves. So I'll stick seeds on their bodies at certain points, and then I'll ask them to basically press on those seeds to activate the acupuncture point as and when needed. Okay.
And so that potentially could be used in the ear as well. You could actually use it in several other locations.
Yes, wherever there's less tissue, like it's closer to the bone, because it won't be so effective if I was to use it on a denser muscle.
Exactly, and that actually stays in location, and the patient can actually use pressure on that to help assist.
Yes. Did you want me to show you?
Sure, yes, let's show the audience a demonstration of a seed.
So this is just surgical tape and a little seed attached to it. And should I take that needle out for you?
Why don't we just go ahead and just for demonstration purposes.
Okay, so this point is called Heart 7, and it's a really good point. It's on the inner side of your pisiform bone, just on the wrist, and it's really good for basically helping with sleep, reducing palpitations, anxiety. Yes.
That's wonderful. So this demonstration again helps people understand that acupuncture is really quite relaxing, and if you're fearful of needles, it's just a pinch sensation, and then really the treatment's quite relaxing. Yes. Thank you so much for joining us.
Thank you for having me.
Sharing all this wonderful information. Coming up next, we've got natural treatments for anxiety.
Thanks so much.
Yes, it's very good.
Do I need a tissue?
Welcome back to Revive Life. I'm your host, Naturopathic Dr. Joelle. Our show today is to help anyone who experiences anxiety or knows of anyone who has anxiety. Another tip for you is a gentle remedy called Rescue Remedy, which I like to call stress release in a bottle. It's a combination of Bach flowers that help soothe and ease tension. Rescue Remedy is made up of 5 individual flower remedies that will help you cope with the different emotional aspects of stressful situations. Rock Rose is used for panic. Impatience addresses irritation and impatience. Clematis is for inattentiveness and a lack of focus. Star of Bethlehem is for shock. Cherry Plum helps with irrational thoughts and a lack of self-control. You can pick this up at most health food stores and is a great remedy for kids also. Our next guest includes Dr. Andrea Prue, who's a specialist in helping her patients take an active role in their health and enjoy a happy and active lifestyle. She believes in personalized care and addressing the root cause of disease, working together with a patient to see new perspectives and realize new goals. Welcome. It's great to have you here again, Dr. Prue.
Excellent. I'm glad to be here. And we see we coordinated our
exactly. We're spring. We, visualize spring and spring will come, right?
Exactly.
Have you had a chance to check out any of the tulips yet at all?
The official tulips, just the one in people's yards, tulips.
So, anxiety. From a naturopathic perspective, how would we as practitioners look at anxiety differently than maybe somebody else?
Naturopathic medicine, as you know, is all about the philosophy of medicine in terms of looking at the big picture. I say to my patients, we're taking all of these different pieces from these different hormone systems, body systems, how the mind's reacting, how the body's reacting, and putting them all together and looking at what that root cause is. And maybe the anxiety or the fear or whatever other symptom is coming out, but it's exactly that, it's just a symptom. So we need to take all of these pieces and figure out that baseline or that root cause that's part of that big picture.
Exactly.
So, I find treating anxiety exciting and sometimes a bit frustrating because you're looking at so many pieces that could be a part of that.
Layers of it, exactly. Because it could be nutrition, it could be hormones. And so when somebody comes in with anxiety, what are some of the typical tests that you would want to run?
It depends on how they're manifesting their anxiety. Anxiety, of course, being more frequently seen in female populations because of the link to estrogen, where high estrogen can cause anxiety symptoms. So I might need to run some hormone panels. Salivary hormones, because they're much more specific than blood-based. So that would be one thing I would look at. I might also look at red blood cell health, white blood cell health, thyroid hormones as well. This can be a big piece of it. And you see anxiety, people think of hyperthyroid condition as having the anxiety, which absolutely it does. But we're also seeing some anxiety with the hypothyroid. So what once was thought to be the kind of cold, I'm fatigued and lethargic sort of hypothyroid picture, we're now seeing more of that internal anxiety part of it as well.
And I think that there's a link to the adrenal gland. When that gland gets fatigued, the backup organ is the thyroid, and it slows everything down to try and reset the body. So it makes sense that that might be the case. In terms of treatments, what kind of things would a naturopath think about to assist her patient? Or his patients.
Fair enough. I'd definitely look at nutrition, absolutely. And I say to patients, just because that one food, say a tomato is a healthy fruit, vegetable, it doesn't necessarily mean it's healthy for you. So we need to look at those symptom pictures. So using clinical nutrition, using botanical medicines, so herbs in liquid forms or capsule forms or food forms. Using a lot of homeopathy can be great, especially with kids or with anyone who's on a pharmaceutical drug as well.
And a lot of people don't quite understand what homeopathy is. What exactly is homeopathy?
There's many ways of describing homeopathy. It is a very dilute form of whatever it is that remedy may be. Frequently it's like plant-based or maybe mineral-based, it could be animal-based, but it's again a very dilute form. I like to describe it to my patients as being a mirror that you're presenting to your body. In the same way that when someone's having allergies, one of the remedies could be very dilute onion, for example. There's a few varieties, but because you want to give that picture of onion. So what happens when you cut an onion? You know, the itchy, watery eyes, a stuffy nose. Same with allergies. So giving that mirror to the body reminds you, oh, hey, I have this symptom that could be there. Because we tend to forget, you know, like it happens all the time. Well, how